Hi, good morning, everyone. Today, we're going to show you some of the mythbusters of COVID-19. It's a small presentation of 25 minutes followed by some FAQs. I hope it's going to help you to understand the disease better.
Hello, this is Dr. Anshu Mahajan. I am consultant in Medanta Hospital, Gurgaon. Here we'll talk about the topic that's on everyone's mind. Yes, it's coronavirus infection, its treatment and prevention part. We'll also be clearing various doubts and busting myths that will be beneficial to the general public.
Hello everyone, my name is Dr. Piyush Ojha and I'm currently working with the Department of Neurointervention at Medanta, Gurgaon. These are once in a century times which the world is facing in the form of corona pandemic. Our scientists and doctors have worked very hard to provide us with vaccines, which are not only helpful in controlling the pandemic, but also have been shown to reduce the severity of infection in a patient. With this presentation, we have not only tried to cover the basic aspects of the disease and its treatment part, but also various aspects related to the vaccination. Towards the end of this presentation, we also included a separate section of frequently asked questions, which come across everyone's mind related to this disease. Please feel free to reach out to us if you have any other question or feedback. Stay safe, stay healthy. Thank you so much.
Some of you might be just wondering what are neuro people talking about COVID, because COVID affects all part of the body. And these are the pictures from last year, April, when we started treating COVID patients who begin to have stroke. And from there on, we began interested in the research and few of the things which we have understood along with the world body, and we're going to show you. And it's more of an informal sort of a presentation, and most of the things should be discussed in the Q&A following this. So basically common sense, not much of a science. And I think we all know about COVID-19 now, and at least the basics of it, that it's a virus, how it spreads. And unless you have been like, I guess it's a Logitech. You people are very technology friendly, so you will be knowing what it is all about. The main problem which comes is when we start talking about protection, we first need to know how it gets transmitted. So when it first started, we focused on droplets that when an infected person coughs or sneezes, they spray droplets on the other person, and through that the infection transmits. We then also talked about the fomite route, that these droplets may get deposited on our laptops, covers, packages, and through that we may get infected. But we didn't talk a lot about aerosols that time, which now have become to shown that these are the major source of transmission in this COVID-19 virus. So the difference between droplet and aerosol is droplets are bigger in size and heavier, and that's why they travel less than 6 feet. And that's why the initial thing of keeping more than 6 feet distance came. But aerosols are lighter. They are like spraying your deodorant into the air, and they can hang in that air if there's not proper ventilation for quite a bit of time. And of course, they can travel freely, so the 6 feet distance doesn't count. The fomites, on the other hand, is more and more questionable. I think most of the world is now agreeing that the fomite is not the source of transmission. So if you are in a close contact with the person, of course, the droplets, they carry larger volume of viral load, and you will have more chances of getting an infection. But similarly, even if you are away, if you are more than 6 feet away, still you can get it because it's the airborne virus. It's in aerosols, but the fomite transmission is questionable. So it's a big paper which have come out in Lancet, and those of you who are keen to read it, it's not a medical literature, but it is very precisely written and you can read through it. One of the most important argument which strikes out here is that the people who were staying in quarantine hotels, they were like strangers, never met each other. They also got infected because the ventilation room of the hotel systems were common. So, and they also concluded that the fomite transmission is not there. So it's a bad news for you in a way that, whatever you were doing since last 1 year, that sanitizing surfaces, I know people who were washing their breads, vegetables, soaking them in surf powder, that all was probably not required. And it's the chances of getting this virus is less in outdoors as compared to indoors, because if there's good ventilation, the chances of you inhaling a good viral load for you to get infected is less. very important thing is focus on your mask. If you're having a good mask with you, that is going to work more as you go out to work when the lockdown opens up. But forget about the sanitization part, it's probably not that important. The other thing which you need to know is if you get infected, the incubation period, like the time from when you get exposed to a virus and the time till you can show a symptom can be as long as 2 weeks. And don't get alarmed if you get a fever after 10 or 11 days of your potential exposure thinking it was too long back. No, you still can get it. And as you become more symptomatic, that's the time you are most contagious to your family members and friends. But even 48 to 72 hours prior to you showing a symptom, you are heavily loaded with virus and you are contagious. Most common symptoms: fever, dry cough, breathlessness, tiredness, diarrhea, headaches, and most commonly talked about, loss of taste and smell. The serious complications which we do get to treat is stroke. Basically, what we need to understand is it tends to clot your blood. And if the clotted blood gets stuck in brain, it will cause stroke. If it gets stuck in heart, it will give you a heart attack. If it gets stuck in your lung, you will get a lung attack and so on. So we check the levels of D-dimer and other stuff to make sure that your blood is not thick enough. And if it is, then we need to give you blood thinners. Basic hygiene, social distancing has to maintain. Masks is the most important point, and avoid close contact with the people. Coming to type of masks, again, we started with any mask is good, but then we realized as it's more of an aerosol transmission, if you stick with your cotton mask, they're good, but they provide you protection in only 50% of cases. And that's where the double mask theory came in, that you need to have two masks then if you're wearing a cotton mask. Surgical masks sort of give you a protection of around 80%, and the best are, as the name says, N95, because they give you almost 95% protection. Do not wear a mask with a valve, because then you are not protecting others. You are exhaling the virus if you are infected. So wear a good mask. If you do not have N95, double the mask up, because it's an aerosol. Uh, it's a transmission through aerosol. So we need to be careful. The smaller size particles which can go through the larger pores of your cotton mask. Other important question which comes to your mind is, once I am being vaccinated or my family members are being vaccinated, should I take off the mask? Now, the simplest answer to this is visit an hospital. All of us, doctors, nurses, paramedical staff, we got vaccinated in January and February. Do you see us walking without masks? The answer is no. So should you be. So wear your masks. We need to fight this together. So the COVID appropriate behavior has to continue. Question about vaccines, Covishield, Covaxin, and now Sputnik is going to be available. It's available, I heard, in some centers in Hyderabad. Apollo is tying up. So more choices coming up. More choices means you have more questions. Which vaccine is best for me? So I'm a guy, so I talk about, like, should I buy a Merck or BMW? Few of you who are food lovers, you debate Domino's versus Pizza Hut pizza. In essence, get whatever you can. So they all have good efficacy and they are very, very safe vaccines. So the answer to all the questions of your safety is a big yes. And in fact, yesterday, you must have read, Government of India did release the clotting factor issues, which were raised a red flag by the European Union. We were finding zero point 0.6 per 10 million cases. So it's a very, very low statistical number. Minor side effects like fever, myalgia, local pain at the injection sites can still happen, but chances of a serious adverse infection is far and few. Now, this is one question which we get bombarded every day. Doctor, I'm suffering from this, I'm suffering from that, my dad is having sugar, this and that. Should we or shouldn't we take vaccine? Is it safe for us or is it not? So you have to remember few basic things. If you have a history of a very severe allergic reaction, so what do we mean by severe allergic reaction? Where you need to be hospitalized, you had to be given injectable medications, or you developed a lot of hives, redness, you developed swelling of your cheeks, eyelids, lips. By eating or by smelling something or through some medication, that means you have a very severe history of allergic reactions. You should probably refrain from these vaccines. Minor allergic reactions are not a contraindication for these vaccines. If you are actively suffering from COVID, then you should not get these vaccines. You should ideally have a gap of at least 4 to 6 weeks. If you have received plasma therapy, then you should wait for at least 3 months before you can get these shots. If you are sick, you are in hospital for some other reasons, do not take these shots now. Wait for yourself to get cured and then get these shots. Most controversial thing, pregnant and lactating women. It's a big part of our community. So the initial recommendation was not to give them because, as you know, all these trials were done and they need volunteers, and there were no volunteers for pregnant and lactating women that time. So the government of India recommendation still holds that it should not be given. But more and more data which is coming from Western countries has proven that these vaccines do not cross placenta, they do not get secreted in milk. So probably it is safe. And you can actually discuss with your doctor and decide whether you should or you should not go for it. We all are hoping that this guideline is going to change very, very soon, and pregnant and lactating women will also be eligible to get these shots. Apart from that, history of heart attack, history of stents in your heart, kidney, diabetes, any previous history of brain issues, your sodium, potassium, any other issues is not a contraindication. You can go ahead and get your vaccine shot. The other question which comes up is, I was in a party, or I was with a group of friends, or I was with a colleague, and then he developed symptoms. Should I get tested? The answer is yes. If you have attended any high risk activity, you should get yourself tested. The best test which has been proven is RT-PCR. And the most important thing which you need to know about it, it's not 100% specific. 100% sensitive. It's specific but not sensitive. So what can happen is, if you do the test too early, like the day you are exposed, the virus may not be present in sufficient quantity for this test to detect. So if you wait for a couple of days, so ideally day 3 or day 4 of your symptoms, then the viral load is the maximum in your body. Chances of RT-PCR test to pick up the virus is highest. Even then, it's not 100%. So if you have got symptoms, but your test comes negative, I'm sorry, you cannot celebrate yet. You have to wait and consider yourself positive and continue to isolate and do the COVID appropriate measures. The other tests, like rapid antigen testing, is for mass screening. Again, if it comes positive, it's positive, but if it comes negative, it does not exclude you. You may be asked to go for a RT-PCR test. Antibody testing is generally not recommended. It just denotes that you had an infection in the past. There is again a lot of crossovers, so it's not recommended for diagnosis of COVID infection. You must have heard, we as doctors, we order a lot of parameters if we know you are suffering from COVID infections. So CRP, which is your C-reactive protein, ferritin levels, LDH, they all tells us whether how severe your infection is, while your D-dimer levels will tell us about your blood clotting tendency, whether you can have a thromboembolic complications, whether we should put you on blood thinners. And depending on their physician, you may be asked to get this test once or twice, depending on how the levels are, to see the trends in them. The other common investigations could be chest X-ray or HRCT chest, which use different scores, see whether you are positive or negative. If your CT scan shows these white sort of things in the lung, then you are suffering from COVID infection. In this case, most of the lung is spared except for few areas. But if it is severe, when most of the lung is involved, that means the patient is having severe COVID infection. If you are vaccinated, your chance of severe lung infection is very less vis-a-vis if you are non-vaccinated. So dramatic picture to again push you towards vaccine, provided you get a vaccine. We are having shortage of vaccines as we speak. So CT severity score from 0 to 25, again to determine how severe is your involvement of lung. So 0 to 8 is mild, 8 to 16 is moderate, more than 16 is severe. Oh my God. This is a post-lunch session and we see a lot of maps. Oh, no, no, not map. It's a graph. Okay, yeah, it's a graph. Okay, so we are focusing. So look at this. Don't get alarmed. So this is number of days as the virus multiplies in your body. So the red one is the virus multiplication. So you can see in the first 7 days, the virus is multiplying. And that's why if you do your RT-PCR test here, probably it won't be detected. But if you do your RT-PCR in this region of around 3 to 4 days, the chances of detection is high. Similarly, your body is also fighting. So this inflammatory factor is rising, which tends to rise above 7 days. And this also leads to problem because the body's response sometimes can be exaggerated. And that's what the medications try to do. So in the early phase of viral replication, we gave a lot of antiviral medications and Fabiflu and other stuff. Remdesivir is given in this early phase. While in the late phase, when the body is fighting, that's the time to give steroids and other blood thinners. So plasma therapy is now, again, as of yesterday, they have discontinued plasma therapy because they didn't find it was good for the patients. In the late phase, steroids and drugs like TOSI, which will suppress your immunity or immunosuppression, that will help the body to fight against the disease. So some management of COVID infection, if you cannot get beds like in Delhi, you can manage mild patients at home. So mild means when you are just having fever without any shortness of breath, home isolation, doing physical distancing, indoor mask use, management of the symptoms at your own by giving Combiflam or paracetamol, antitussives, antiemetics, vitamins, steam, monitoring your fever and oxygen levels, and of course be in touch with your physician who can warn you if the symptoms are getting worse, whether you need to come to the hospital, whether you need some more tests. But for sure, if you get trouble in breathing, if there is pressure or pain in your chest, if you're confused, if you're turning blue, please go to the hospital. For a moderate sort of disease, ideally the patient should be in the hospital. But just in case if you are not getting a hospital bed, again, you can start oxygenation at home. Maybe do use oxygen concentrator or oxygen cylinders, and maybe your physician will ask you to start steroids or blood thinners depending on your condition. If it becomes very severe, then of course an ICU admission is required and the physician there will take care of most of the aspects. These are few of the medications you can keep in your medicine cabinet, and most of them are simple antipyretics like paracetamol or Combiflam, antibiotics like azithral or doxycycline, steroids if you do require them, vitamins, MSET, and Fabiflu. If the saturation level is dropping below 94%, you do not have good access to oxygen care, you can try proning. That means lying down on your stomach and put some pillows under your leg and the waist belt and one pillow under your head to support. What happens is the bigger part of the lung is on the back side. And when we lie prone, that is raised up and the oxygen or the air will go up as it's lighter. And that's why your saturation will improve. You can try rotating every half an hour to different positions, aerating different aspects of your lung, and that will help in improving your saturation level. Of course, if you feel pain, if you feel discomfort, if your saturation level is not going up, then you should consult your physician or go to a hospital. Oxygen cylinders, when using at home, do remember these are pressurized cylinders. They have to be handled carefully or they can lead to fire hazards or accidents. The best thing is, of course, an oxygen concentrator, which takes the oxygen from the atmosphere, concentrate from 21 to 90%, and then give it to you. And depending on the load, it can give the supply. So if you use a small oxygen concentrator like 5 to 10 kilogram, it will just be able to give 1 to 2 liters of oxygen per minute, which will not be sufficient. So you need a bigger concentrator, like at least 10 to 15 kilograms, which can give you a supply of 5 to 10 liters of oxygen per minute. While you are managing these patients at home care, do remember the basic concepts. Stay at least 6 feet away. Make sure the person who is taking care of the COVID patient should not be sick himself, should not be a high risk case. Isolate that person in a separate bedroom, but with a good ventilation, a separate washroom if possible. And we know that it's an aerosol spread disease. So maintain the ventilation of the home. If it's a centralized AC, then you cannot. But if it's a window or split AC, you can use them. Ideally, the patient's room should be connected to balcony or an open area. Cross ventilation should be allowed so the aerosols do not linger in the room. Other important thing which we have to remember is these patients, they are staying alone, and mental health also needs to be taken care of. Do not ignore them, talk to them regularly. If not in person, use social media, use technology, connect with them, tell them that it's not a big thing. 95% of the people with COVID, they do come out without anything. And billions of the people have been affected and they have recovered. So only less than 5% of patients do require ICU admission or they have adverse events. So it's important to talk to these people again and again. Restrict your interaction with the pets. Do not allow visitors. Wash hands. Separate trash for the ill patients. And in case if you need to transfer these patients for a scan, investigations, or to the hospitals, ideally it should be done in a dedicated ambulance. But if the ambulances are not available, as was the case in Delhi last week, then use common sense. Wear double mask. Ideally, one of them should be N95. Ask the infected person to sit in the back, diagonally opposite, as far as away as possible. Turn off the AC, roll down the windows, let there be a good cross ventilation, wear gloves, and then go and take them to the hospital or the center for investigation. Eat good protein-rich food, fish, chicken, soybean, pulses, good nuts and fruit diet. Improve your immunity and improve your chances to fight against COVID infection. These are few of the questions which we have compiled while we have interacted with the general public, and I'm just going to run through few of them. Maybe they are there in your mind, maybe you are smarter and you have better questions at the end of this talk. So can we mix the vaccines, like one dose of Covishield, the other dose of Covaxin, or maybe Sputnik, or maybe something else? No, because different vaccines work on different principles. So the government of India does not allow you to mix vaccines. So the person who has got Covishield should have a follow-up of Covishield, and so on and so forth. So it's now we know it's an aerosol spread disease. So can I go outdoor and still be safe? Yes, because it's not like stepping out only in the outdoors and you will inhale the virus. You need a certain quantity of virus to be inhaled. Outdoors is where the air transmission is good. Chances of you inhaling the virus just from the outdoor air is very rare. And if you're wearing a mask, it's even more rare. Mild seasonal allergy is not a contraindication. The only severe allergic reactions in the past are contraindications for vaccine injections. That's the most common question people ask, like people who are on blood thinners for any cardiac condition, stroke, or for anything else, is it safe to get them vaccinated? Antiplatelets, anticoagulants, they are not a contraindication for vaccination. You just need to press that site once you have been vaccinated so that the blood does not accumulate there. These blood thinners, what they do is like they have a chance of blood oozing out. So just compress there for 5-10 minutes and that should be more than enough. So now a lot of social media news, vaccination has a lot of side effects. And this actually was happening last month when the vaccine was freely available and nobody wanted to have it. Now it's not available and now everybody wants to have it. People are driving 200 kilometers. So we all know that the risks are far and few. The statistical probability of getting a risk is very, very low. Benefits are far more. Please get yourself vaccinated. Of course, slot availability is a question. Is it necessary to get admitted in the hospital for all COVID patients? No. Mild to moderate patients can be managed at home. Do be in connect with your doctor and he can help you out in making that decision. CT test, is it required in all the patients? No. Again, mild patients do not need it. If you have worsening of symptoms, then, or maybe on day 5 or day 6, if your doctor wants to prognosticate your course, he may order a HRCT test to look at the lung condition. high fever, cough last 5 days, RT-PCR negative on first day. Should I get a repeat test done? So you can get a repeat test done because test results can be negative during the early phase also. Even if your second test comes negative, with these symptoms in this scenario, we have to assume you're positive. It's just that your RT-PCR test is not able to pick up your virus. Now, we have to also understand, we hear so much about COVID-19, newspaper, media, social media, everything is full of it, doomsday theories and everything. But do remember, most of the patient recover without problems. So keep your morale also very high. Now I've completed my vaccination schedule. Should I go out? As I answered before, there's no guarantee. You still need to wear mask, take all the necessary precautions. Vaccines start working from day one is a myth. So 2 doses, and even after that 2 weeks it takes for your body to make antibodies, and then also you are reasonably protected. It's not 100% protection. Nothing in the world protects you 100%. So whatever you are doing, couple it with mask and safety measures, and then probably you are protected. Now this is happening very commonly, that people get a vaccine shot, then few days later they became infected with COVID. Now, should we take the second shot on the same time, which was scheduled? Should we delay it? What should we do? So if you have taken a first shot and then you got a COVID, you should wait for 4 to 6 weeks before you take a second vaccine shot. You are protected in between because you got a COVID. That also is like a vaccine for you now. So you can delay your vaccine shot by 4 to 6 weeks, and then you will have a extended immunity against COVID-19. Can I donate plasma after vaccination? Yes, you can, but now ICMR says it's useless. Can you donate blood for any other reason after vaccination? Absolutely, you can. Now, pregnant or lactating female, as I said, guideline says no, but common sense says yes. So probably you can discuss it with your doctor. Now again, we are hearing a lot of people who have gone to vaccination centers, get themselves vaccine, but again, there's a risk that they can get infected there because they are crowded areas. So should we wait? Should we get ourselves vaccinated? And I think it's a very difficult question. We want vaccine as quickly as possible and as safely as possible. You only can determine whether it's safe to go out in your area or not. Should I wear mask inside my house as well? It's nearly impossible. Do it only if your family members is suspected. Nobody can wear a mask 24/7 indoors. Again, clot formation is happening. We know that. Should I start blood thinner on my own? Blood thinners are not safe to take it on your own. You may end up with a brain hemorrhage, abdominal hemorrhage, or worse. Do it in your doctor's consultation only. Can people with autoimmune disease take vaccine shots? Yes, they can, no issues. And I had developed a COVID positive infection without symptoms, never got tested, but can I still take a vaccination shot? I don't know how you know that, but you can go ahead with your vaccine. Many people with symptoms are testing negative because we know negative test does not rule out COVID. So there is a chance that RT-PCR may still not pick up your COVID infection. So can it travel from toilets? Can it travel from balconies? We do not know. So it may or may not. Again, take COVID appropriate behaviors, keep the toilet lids closed. Most likely it does not travel that way. Chances are less, but nobody can say one way or the other for sure. AC and coolers can be used at home until unless you have a centralized AC or you have a positive member at home who does not have a isolated air conditioning system. So can COVID patients be completely asymptomatic and still test positive after 2 to 3 weeks? It's a possibility. Virus stays in our body for a long time, though it's a dead virus. Person with seizures or epilepsy, they can take vaccination. There's again not a contraindication for that. And should I start Febiflu my own? No. So except for paracetamol and some vitamins, I don't think you should start anything on your own. You should ask your doctor's help and advice. And of course, you should not start prophylactic blood thinners. Absolutely not. It's a big no-no. So if you have been a good Samaritan, you have helping out people to go to a hospital, but you have used proper protections, do not panic. But if you do develop symptoms, get yourself tested. So biggest mistake, one word, carelessness and ignoring your initial symptoms. I know scores of people who go into denial, and even doctors, when they get infected themselves, oh, it's nothing. It's just one fever. Maybe I have done something wrong. I have eaten a bit of cold food, drink this, drink that. Please consider yourself to be infected until proved otherwise. So post-COVID care, again, proper diet, exercise, medications, and a lot of meditation. Mental health is also very important. Believe in yourself. So very, very difficult questions here. How long will it last? Will we need vaccination forever? Some of the questions I also don't have answer for. And if you have any more information, you can contact your doctor for them. If you do not have one, we are there to help you out. You can reach out to us. So that's about it from my side. And if you have any questions for us, please do let us know.